yeah, just a heads up on that. All right, so we'll get started now. Let me just share my screen. Cool. So we'll start with an overview of what the New York Health Act is for anybody who's new to it. So we need a public health system. The current system, as we all know, is disastrous. It's overly complicated. It doesn't work. It's overly expensive. What's wrong with it? It's profit driven and it's employer based. American health outcomes are tied to our employers, our ability to sell our labor. As we've seen over the last year with the pandemic, the combination of health issues and joblessness that we've been facing proves how outdated and impossible to operate the system is, and that we need to move from a different model than employer-based healthcare. Sick people are expensive to insure, so insurers coerce them into taking on more of the cost themselves. When your economic standing determines your access to treatment or your ability to pay for it, the system values the enrichment of the healthcare sector over the actual health and dignity. It's the things we've been saying for years. When you put profit over people, the result for working class Americans and working class New Yorkers specifically are disastrous. The soaring cost of healthcare contributes to many burdens for the public: loss of coverage, inadequate coverage, medical bankruptcy, financial rationing, surprise bills, preventable disease, many others. Even for those of us that have healthcare through our employers or through public means, the system can be better. It's not only is uninsurance a problem, but underinsurance is a massive issue. And none of us are happy with our insurance system. It doesn't operate nearly as well as it should. Most importantly, despite the fact that healthcare is not available to everyone, the U.S. spends more on healthcare per capita than any other rich country. Not only are we the wealthiest country on the planet, we spend the most on healthcare and have one of the lowest insurance rates among the other wealthy countries. We're wasting money. We're not insuring people, and the system needs to change. Just some stats on why this system is so bad. Americans pay 3 times per capita what high-income nations pay for healthcare. We rank among the lowest in life expectancies, among the highest in maternal and infant mortality rates. We top the charts in rates of death from preventable diseases. 30 million people in the US are uninsured and 30 million people are underinsured. This also doesn't take into account COVID. Some of the data isn't up to date yet with everything that happened over the last year. So these numbers have undoubtedly skyrocketed after the pandemic. Even those of us with insurance bear increasingly unaffordable premiums, deductibles, and copays. Every year premiums go up, but our coverage stays the same. And during the pandemic, the number has risen to 92 million uninsured or underinsured. The system isn't sustainable, and it's time for a change. Why does it operate like this? Like I said earlier, profit over people. The health insurance CEOs make $20 million a year, which is over $350,000 a week, which is a ridiculous amount of money that nobody needs, especially when people don't have health care. To say that we can't afford it while people are making that much money is laughable. The administrative bloat of health insurance companies is obscene. And most importantly, the healthcare industry made nearly $55 billion in profits during the last quarter in 2020 alone. So during a pandemic, while the country was facing one of the largest crises it's faced in years, the healthcare industry was profiting more than ever. There's a massive disconnect between what we deal with and what the insurance companies deal with in terms of our health. So why do we want universal single-payer healthcare? Everyone would have access to quality healthcare regardless of income. It doesn't matter if you're employed. It doesn't matter how old you are. It doesn't matter your gender, anything else. You would have access to good quality healthcare. By pulling everyone into one plan, we'd have much lower overall healthcare costs. You get more choice. You can choose any healthcare provider you want. There's no more network hurdles you have to jump through. You don't have to argue with your insurance to get coverage. All procedures and medications are covered. We get rid of all of the administrative burdens that we deal with, which are significantly lower administrative costs, lowering costs on our end, and also lowering costs on the provider's end, because they don't have to spend time arguing with insurance anymore, and they can focus on the things they want to do, which is helping their patients. And the most importantly, it addresses the roots of healthcare inequity by getting rid of all the gaps in our current system. So why do we want to do this in New York? New York is one of the handful of states with an active single payer healthcare bill. Now more than ever after the pandemic and after the crisis of the last year, New Yorkers need protection. And like Jabari said earlier, if we pass the New York Health Act, we set a precedent for Medicare for all for the rest of the country. This could be the domino that gives us Medicare for all and forces Congress to act on that. So what is the New York Health Act? Every New York resident and those who want to work in New York but live elsewhere may enroll in the New York Health Plan. It covers all medically necessary services. It prohibits a tiered healthcare system where some get access to better services and others get access to worse services. Everybody's on the same plan. So the wealthy and working class New Yorkers all get the same coverage. Like I said, it gets rid of network restrictions. So you could visit any provider in or outside of New York that chooses to accept the New York Health Act. And most importantly, medical decisions will be made by you and your doctor. You don't have to negotiate with an insurance company anymore to get coverage that you need. And that's just a little introduction on New York Health Act. And now Keith is going to introduce a little bit of the funding side of it and how we actually get this done.
Okay, hey guys. So the thing that people don't understand is that, Noah covered some of the reasons why our system is inefficient, but it's so bad that people literally won't believe you when you tell them that the New York Health Act will save 90 to 95% of New Yorkers' money, will give everyone healthcare coverage, will save New York State billions of dollars every year. Because that's how inefficient our weird current system is. So let's talk a little bit about where the money is coming from now, where it's going now, where it will go under the New York Health Act, and I'll leave you with a couple of talking points about how to convince people of this. So, okay. All right. Most important thing is that the New York Health Act, the law itself, generates revenue, mainly through a tax, which we'll talk about in a second, but it's self-funding because passing the law passes the funding mechanism. So every year, the money that New York State will spend on your healthcare under the New York Health Act is already there. It doesn't need to be passed through the budget. There is some slightly wonky budget shenanigans about basically startup funds, but once it's passed, it will have the money to fund itself every year. Now that money is already in the system. And there's a lot of different ways it's going to people who don't deserve it and who it's not going to people who need it. And the New York Health Act simplifies things and reroutes some of the money that people are already spending. So for example, everybody funds the employer-sponsored insurance. Everyone pays taxes, and some of our taxes go to give tax write-offs to companies for buying health insurance. That saves companies money. Why not use that to spend on healthcare? Okay. So let's talk about where the money is going right now. Basically, what are the current sources of funding for the status quo? And Noah, if you could go to the next slide. Great. All right. So there's basically three main sources of funding. Premiums are what you pay every month to have health insurance at all. Those are usually split 80-20-ish with individuals who have employer-sponsored insurance. That's health insurance that your company gets for you, paying 80% of it, and employers paying just a little over 20% of it. But even the public programs usually require premiums because we're addicted to this, I guess. So things like Child Health Plus, Medicare D, which is where you get prescriptions, they all have premiums. They're lower than non-public programs, but they're still there. Like, we can't imagine a system until now that doesn't have premiums. So yes, the money that corporations pay now will be going to the New York Health Act. And in 2 slides, I will point out exactly where that is. The other one that lets us pay for healthcare right now is taxes. Taxing is a patchwork system. America is, the states all have different laws and different constitutions, and it's called a federated system, and it makes things very complicated. But essentially, you could think of state taxes, primarily income taxes. There are some municipality, city taxes, and a lot of it is federal taxes, where there's a payroll tax and a tax on non-payroll income, which goes to support Medicare and Medicaid. Now, again, like I mentioned, by not taxing employers spending on healthcare for their employees, we are leaving almost $200 billion on the table. And so that's sort of a deficit that the federal government, if it just gave everybody healthcare, would be able to recoup. The final way we pay for things right now are out-of-pocket payments. So copays, reinsurance, or things you just buy without insurance, procedures, or you don't want to deal with it, anything like that, any optional procedure. So right now, those are the three broad categories of how we pay for it. Now the specifics are ugly. Now let's see the specifics. Okay, I'm not going to go through this. If you want, the slides are available. This is the current lean, efficient, private system of how your money flows from New York residents through 8,000 intermediaries, most of whom take a cut, and most of those just turn it into profit. So basically, you know, a substantial number of these arrows leak money out of the system. So let's talk about how it will be paid under the New York Health Act. Essentially, the majority of the funding for the New York Health Act is built into a new payroll tax. It's a progressive tax, and it is split 80-20. So employers pay 80% and employees pay 20% on earned income. All of this goes into a giant pool of money, along with the federal funds we're currently getting from Medicare and Medicaid, local taxes that would pay into it, all these things. We put it into one huge pool to pay for all New Yorkers, just like all New Yorkers are in one huge risk pool. So it's actually cheaper because as a universal system, we're spreading the risk around. If this were an optional public system, it would be reasonable to expect that the poorest or the sickest, because that's how our country is set up, would be the ones in it, and so the costs would be the highest. But everyone is in it, so spread the risk around, spread the money around. There's also a non-payroll tax in it, so that helps close in the loopholes on like capital gains and other income not subjected to normal payroll taxation. For the old taxes, the federal taxes won't change. Basically, you pay the federal government for Medicare and Medicaid, and then the money they send to New York would get through a waiver system that I'm not going to get into, would just get put right back into the pool for the New York Health Act. State and local taxes will probably change, though. They are quite likely to go down because the state and local, city, state, county taxes pay for health insurance. And so counties will save hundreds of millions of dollars and likely pass that off to you. In addition, you'll see in a second some of the knock-on effects, I always get that wrong. Sort of like extra economic boosts from giving everyone health insurance means that wages, income, they're all expected to go up. So states will now get more money through the taxes, so they could probably lower it. All right, let's look at the new model and compare that to the previous graph. All right, well, it's not like only 4 lines, but it's a lot prettier than the one before it. Basically, other than that weird back and forth with the federal government where you send your taxes to Washington and then they send it back, it's a lot simpler. You pay taxes to the New York State, we put all that money in a pool, and we give it to sick people who need it. All right, so the effects of that are pretty amazing. Basically, it starts off relatively small, ramps up by year 10 to saving about 3% of what we spend on healthcare a year. Now that doesn't sound like a lot, but we spend so much money on healthcare and have awful results, as Noah was saying. So that's about $80 billion over the first decade. There's quibbling with this. I think it'll be higher, but minimum of $80 billion. It's expected to wildly increase employment, 2% jump. That's including the fact that this would make insurance that covers what New York Health Act covers illegal. So everyone who works in insurance is not going to in New York is not really going to have a job. The New York Health Act has been around for long enough that they've taken this into account, and there's retraining programs to take care of them. But even with losing all of that, it's expected to increase employment 2%. That's 150,000 new jobs. That's because, first off, the state will need to have people to run the system, but also because people will be paying less for healthcare, which means they will have more money. And when people have more money, they'll spend it. And there'll be more demand. And so there you go. Insurance coverage is total, complete, universal, 100%. Every New Yorker, every worker who comes into New York who wants to buy in can have it. That's it. No questions. You go to a doctor, they don't ask to see anything. They don't ask you to pay anything. You're there and they heal you. So 90% of New Yorkers will pay less in healthcare costs, and it's hard to calculate exactly around, but we expect around 2,800 per person in savings. The 90 to 95th percentile of income earners will pay pretty much the same that they currently do. The 95th and above percentile of income will pay more, but even then it doesn't really start to be substantially more until you get to the 99%, and then the 99.5%, and then the 99.95%. It's a steep curve. We think that this will really help save some of these struggling public hospitals and some of the private safety net hospitals, because the rate currently hospitals are racing to try to attract people with high-paying private insurance. This levels the field. So if a doctor would get paid more for taking care of a wealthy person who has expensive insurance than they do for someone who's uninsured, which is the way it is right now, I'm not going to have a lot of hospitals catering to the people who are the poorest, which are, like I said, the sickest. And it becomes this kind of terrible, cycle. And this is all coming from the RAND report, which is a think tank that is centrist, works with a lot with the U.S. military, technically not ideological, but by supporting that, they're de facto pretty right wing. The center is pretty right in this country. And I think the final talking point I just want to shout out is that if you look at healthcare spending as a percentage of income, right now the poorest quintile, yeah. I think they did by quintile, pay about 34% of their annual income in healthcare, and the richest pay about 28%. It is a giant transfer of wealth from the poor to the wealthy. That's what we have right now. By passing this law, by passing the tax attached to this law, we reverse it. It suddenly becomes progressive. And those numbers pretty much flip. The richest of the rich will pay, I think, 1.5% more under this system than the poorest of the poor pay right now. But because they've hoarded so much money, and because income inequality is so insane in this country and in our lives, that is billions. They could pay just a teeny bit more, and we could just give everyone healthcare. So let's do it. All right.
Thanks, Keith. We're moving on now to how to talk about the New York Health Act. If all of the great information about funding didn't convince people, here are some techniques for discussing it with people when you're canvassing. So first, note how to respond to disorganizing emotions. One of those being hopelessness. You often meet people who are encumbered by the feeling that things can't change and that we have no power. It's a very common thing to encounter when you're canvassing. The organizer, in response to that, would help develop a plan to win and share success stories from elsewhere. And then the person will find that hope that change is possible and worth fighting for. Something that they might say is, they'll never vote for something socialist like this. Another disorganizing emotion that you could encounter, division. You'll meet people who are encumbered by being pitted against other groups. Your goal as the organizer is to identify common ground and build relationships. And in result, the person will find unity to act together. So an example of what they might say to you is, why should I pay for other people's insurance, especially if they don't work or are undocumented? As we found in the pandemic, we're only as safe as our neighbors are, and that could definitely be helped by the New York Health Act. Another disorganizing emotion, confusion. We'll meet people who are encumbered by messages that alarm and distract us. Your job as the organizer is to interpret and share information and relate it to the big picture. As a result, the person can find clarity and the ability to reframe what's at stake. So what a lot of people might say is, I don't want to lose my healthcare that I have now. You just have to let them know that what they're going to be having is even better. It's not that they're going to lose healthcare, it's that they're going to lose the super stressful and confusing health insurance industry. Disengagement. So I'm sure you've encountered this often. You'll meet people who are encumbered by a lack of interest in politics as a way to change the world. Your job is to identify ways that the person's life could be better and create a feeling of desertion by the ruling class. So always make sure you're pointing and naming the enemy, and in this case, the ruling class. The person will find interest in their living conditions and possibilities for a different approach. So I'm sure you've heard this. I don't really pay attention to politics. Make sure you can see exactly how politics affects their lives. A lot of people will say, politics don't affect my life. That's not true. Make sure that you can point out to them how that is false. And then here are the 3 keys that you want to keep in mind in any of your conversations with people when you're canvassing. One of them, clarity. Be very clear with what our goal is with the New York Health Act. We want a single public program with comprehensive coverage for all residents that is free at the point of service. Be strong, nothing less will do. There are a lot of other plans out there that offer less, and we're not going to settle for that. We want exactly this, the New York Health Act. Second, name the enemy. Point the finger squarely at the ruling class. Say it's time to abolish the profit motive in healthcare and to move toward a truly social system of healthcare. Point out exactly that they're the reason why we don't have it currently, because it's not profitable for them the way that the health insurance industry currently is. And last, you want to make sure that you are emphasizing mass politics. Everyone loves single-payer healthcare except for the rich because it's not profitable for them. Single-payer healthcare must be won with the force of a mass movement. It can help us build a strong working class base for DSA because, obviously we want to win the New York Health Act, but it helps them change their worldview, helps them to think differently about what they're demanding from their society through this person-to-person organizing. So, great if we win this, and that'll help people raise their expectations for what their politicians are doing for them and what their society owes them. And not least, the New York Health Act would put pressure on the entire nation to pass Medicare for all. So this is political solidarity work. These are class struggle politics. Let's always keep that in mind. And so we wanted to share a method for responding to people's questions. A lot of people are going to have questions. They'll be victims of a lot of misinformation. So try and remember these three guidelines whenever you're encountering a question: affirm, answer, and redirect. So affirm, let the person know that you're listening to them, you understand, and their feelings are valid. This is not the time to get mad at them. It's mostly the fault of wealthy interests who have been promoting a toxic individualist ideology for decades. So they're the victim of it mostly. And so start by affirming. Second, you want to answer their question. Be very truthful, give a concise answer to their question. Don't evade it. If there's a grain of truth to what they're saying, acknowledge that. It doesn't do anyone any good to brush it under the rug. And also, if you don't know the answer to their question, don't guess, because that doesn't do anyone any good. You can either let them know where they could find the answer, and you can make a note to yourself so that you can look it up, and next time someone asks that, as someone might, you're prepared for it. Otherwise, maybe see if they're willing to give you their contact information, and then you could answer it in a follow-up email. That's great. You have a second point of contact. They might get even more involved in the campaign. And third, make sure to redirect back to the main goal of our campaign and in naming the enemy. don't get bogged down too much in a back and forth and debating them. A little bit of debate is okay, but you're not there to spend hours debating. Instead, be ready with a question for them that brings the conversation back to your message and points out how it is useful to wealthy interests that they're distracted. Remind them of their issues, if they happen to share that in the conversation, and that we're making a plan to win, just as previous social programs have been won before. So those are the 3 ones, and we're going to go through some examples of questions that people might have. So one that someone might say is, I already have good insurance. Affirm what they've said. It's quite possible that they're happy with their healthcare, and they don't want to give that up. Second, answer. While they would move to a new insurance plan, insurance provided by the New York Health Act would not only provide insurance for those that do not have it currently, but also vastly improve insurance for those that do have it. There would be no more premiums or copays, no more network restrictions, and it would be far more comprehensive than existing insurance plans. You wouldn't have to ask a middleman about medical decisions anymore. You wouldn't have to worry about whether or not you can afford to go. You can just go. And then redirect it back to the main message. The reality is that we all deserve great health care, whether we're employed or not. The current system is designed to pit us against each other, but we can all have better health care and for cheaper if we work together as working class New Yorkers. So redirect it to mass politics, naming the enemy, and being clear about what we're aiming for. Someone might say, I can't afford to pay more in taxes. This is when you think back to what Keith has told us about funding. First of all, affirm what they've said. I understand your concern. Healthcare costs in this country are among the highest in the world for working class Americans. But then answer it. Although there's a grain of truth, we've got the answer for this. It's important to remember that we're not creating new money. Rather, we're shifting money that already exists from a profit-driven insurance industry to one controlled by the people. 90% of New Yorkers will pay less in taxes than they do now and have no healthcare fees like deductibles, premiums, or copays. Then redirect back. The only people who would pay more are the richest New Yorkers, who should have the burden of paying for the healthcare of all New Yorkers. The special interest groups want us to be divided so that we don't achieve transformative change. The New York Health Act is in the interest of all New Yorkers. So name the enemy, be clear, and relate it back to mass politics.
Yeah, I remember it weird.
I'm an insurance.
Yeah.
I lose my job.
Yeah.
I think we might need a couple people to mute, maybe. Thank you. So I'm an insurance worker. Would I lose my job? I think someone mentioned this question in the chat. First of all, affirm them. It's very valid to be concerned about that because, first of all, I know everyone needs their job. And the New York Health Act would dramatically transform our economy and the big employers in healthcare currently. Second, answer their question. However, while insurance companies will not operate in New York State, the bill will create an entire new state administration that will need to be staffed by thousands of New Yorkers, and displaced workers will be the first ones hired for those. In fact, studies show that the New York Health Act will have improved overall employment by 2%. Public sector jobs often have far stronger employment protections and benefits than private ones. Something to consider. Redirect. We can have a system that works for everyone without going through private companies. The New York State has the money and the resources to socialize healthcare while having strong employment. These myths are created by the insurance industry and their politicians to protect their money. So something to keep in mind that these workers aren't going to be abandoned. There will be a space for them in the new act. How does this affect freelancers? Great question. So first, you want to make sure you affirm their concern. Healthcare is a huge worry for freelancers and small businesses and those who work in the gig economy. Answer, working contract or gig work is great for flexibility because you can decide how and when you work, but employers don't have to offer any benefits. So a lot of workers go uninsured or purchase their insurance from the marketplace. This patchwork system is very far from universal coverage. However, if we shift to a system where healthcare is guaranteed through one public system that covers everybody, that's true flexibility for all workers. You would be able to move jobs easily and build your business or work in the gig economy without fear of medical costs if you get sick when you're not insured, or maintain costly insurance that you purchased on your own. Businesses would lose the unpredictable and always increasing costs of insuring their workers, which means that they would see a lot more profit and they could employ more people. So this would mean a healthier workforce and a healthier population overall. Great. So, I mean, I can't see how freelancers would lose out. I just don't see how we can afford this. Affirm their concern. It does seem on paper like it would cost a lot, the state. Answer. Right now, New York wastes a lot of money in the overly complex way that our healthcare system is set up. By redirecting the money that already exists in the economy, but is hoarded by the 1%, into one single payer for healthcare in the public sector, we could significantly reduce costs and insure more people. Not only would this reduce overall costs and simplify administration for New York State, but it would save New Yorkers $2,800 on average. So make sure you emphasize that we're not, taxing them more. We're not creating new money. We're redirecting the money that's already existing in the economy, and then redirect it back to the main message. Right now, we pay so much in healthcare costs because it is driven by profit. We can have a better system without funneling it through corporations. It'll take an army of working class New Yorkers to win the healthcare system we deserve and defeat the special interest groups, but that's exactly why they should get involved. Common question. Won't the rich just leave the state? I understand why you might think this, because the bill does raise taxes on the rich. However, it is a misconception that the rich would leave if we tax them. The rich have ties to the community in the same way the rest of us do, and they wouldn't just pick up and leave if they're taxed more. In fact, New York is one of the most under-taxed states compared to how large our economy is. When New York instituted a wealth tax in 2009, the amount of millionaires actually grew due to the economic growth. Redirect back to the main message of our campaign. The rich want us to believe that they will leave if we force them to pay their fair share. However, they've showed us time over time that that is not the case. They want us to be afraid of instituting any mass change, and to defeat them, we're going to have to organize a mass movement that is too large for them to defeat. All right, so now I'm going to pass it on to Mo to talk about how we can get the New York Health Act passed.
Thanks, Jenna. Okay, cool. So how are we actually going to do this? There's so much Buffalo stuff in like the end of this presentation. So sorry, guys. Jenna's from Buffalo. Shouts out to Jenna. Noah, could you go to the next slide? Okay, and then here's a picture of hijab in Buffalo from during our Healthcare Emergency Guarantee Act petitioning and canvassing, holding a sign that says healthcare is a human right. Don't we know it, folks? So the way that we get there is by organizing. We must be campaigning our butts off until June to make free universal healthcare a reality in New York. And then hopefully once this domino falls, the country. So we're going to door knock, we're going to canvass our neighbors, we're going to gain support for the New York Health Act, and hopefully eventually Medicare for all. I think that political education and being super smart organizers who absolutely know our stuff so much is going to be super important, and it's going to expose to a large working class base, if we do it right, the contradictions of our current healthcare system and how much is getting funneled through private corporations. We're also going to need to be organizing to pressure politicians to support single payer, and we should do this in a smart, disruptive way that that actually gets, normal people as well as organized labor. I know that, this is a conversation that we've all been having, and there's a labor call on Thursday, but people to pledge, I'm not going to donate to you, I'm not going to commit to you, I'm not going to support you unless you support single payer healthcare. It's got to be conditional, and we have to actually, threaten their careers, I would say. So get people to pledge about single payer healthcare in the state, and if you're working on a Medicare for All campaign. Next slide. So Albany is one of the most corrupt state houses in the country. It is notorious. So how are we going to tackle it? it's an open question. But so the New York State Senate has 62 seats. The state assembly has 150. The way that it works is legislation, the bills are introduced and passed through committees, and then the body votes. The governor has 3 days to sign a bill once it's passed in both houses, or he can veto. He usually puts this off to the end of the year. He totally controls the budget process. As we found out when we demanded 50 billion and got around 5. So things can get watered down a lot in this process, and it's really important that we create a mass movement that shows them it's absolutely not an option. So some of our coalition partners that work really hard on statewide healthcare do storytelling, narrative-based, showing of the injustices of our healthcare system, because that can really grow popular support that translates to political pressure. Like, oh my God, I know somebody who has been rationing their medication, and this breaks my heart. Or I have to ration my kids' medication, or so much of my paycheck goes to counseling, or goes to therapy for a chronic illness that I have. There's so many different human faces to the suffering that our healthcare system causes, that this can be an effective approach if you want to get people to do storytelling. There's also petitioning and pledging, like I referenced, as well as call-in days, so it can really sort of move the needle if a bunch of people flood the offices of our electeds and legislators, where you wake up one day and it's like, oh my God, I got like 25 voicemails about this one thing. People must really care about it. So coordinating those phone banks, lobbying elected officials, so holding constituent meetings if you can get one, outside pressure through rallies and press, if you can, it's a good attention getter, right? And implicit or explicit electoral threats. So like I was talking about with being disruptive, if you have a sort of, support single payer or else, leverage over them, whether getting, constituents and voters to say, I'm only going to vote for somebody who supports statewide single payer or Medicare for all, whatever the legislation might be. Or if you can actually be like, we have somebody who can primary you, even better, right? So the way that DSA differs in our organizing strategy is that we believe in mass movement and working class organization. So we participate in those strategies that I just laid out, hopefully in a more militant way, sort of like in the latter way that I was talking about that's really disruptive. But we also believe in deep community organizing, so door knocking. We've, at least in Buffalo, we've still been canvassing, honestly, just like, wearing masks, bringing sanitizer to everything, at least going to high foot traffic places and getting signatures on the street, or talking about like pledges on the street and canvassing on the street and doing like just, street canvasses. And even door knocking and just like standing back and getting something signed or giving lit and having a conversation at the door. We've been doing, but yeah, we really believe in cutting turf and actually getting out there and talking to people, preferably cutting turf around right or in the neighborhood where those legislators live, is always, it's good to make that one of your days, right? Just really getting their street. So yeah, we're not just in Albany to pass legislation, right? We're here to actually like educate other people and get them on our side about landing a solid punch on capital in the state, because we know that free market corporations basically run the state, and a huge part of that is healthcare, and we need to land this by June. And it's only going to take a mass movement, because we can't rely on a politician's word only. We can't rely on them to do the right thing. We need to build a mass movement that gives them no choice. So canvas first, basically. What DSA has to do is work with a big, broad statewide coalition, identify legislators who can stand up to leadership, people who've been principled and are ready for the propaganda storm that New York Health Act is about to face. Target your friends and your enemies. So for people who have, like I said, who have already co-sponsored, who live in your district, I think that we need to tell them, remain, stay the course. You need to support this. Your constituents are counting on you. You need to champion this because, otherwise there's just this propaganda storm absolutely coming from the special interests on this. And for people who don't already co-sponsor, we need to get on a co-sponsor, right? So you need to show them, there's a huge mass movement behind this that is not going to support you unless you support this. Because we will only, we're single payer healthcare voters, right? Make that someone's identity because they care about it so much. We need to have a strong social media game and media game. So get some attention if you can, and have a strong elevator pitch. I think that the tactics that Jenna just talked about, I'm like, whew, guys, be taking notes. This girl is so good at canvassing. And we have to shout out Philly DSA for helping us adapt some of those materials that we use for Healthcare Emergency Guarantee Act, as well as New York Health Act and stuff. So yeah. Okay, so as far as how this looks now, the reintroduction this year was historic and very, very important. I think it's really, really good that all of us are up in here on this call because there's actual momentum behind statewide single payer right now. I think that, if you're going to be doing one of the DSA statewide campaigns right now, gotta do statewide single payer. Are you kidding me? We can really get this done, I think. So more than a majority of Assembly members are co-sponsors, and it was reintroduced in the Senate with majority support for the first time ever. That's the real game changer. Cuomo has reference to supporting federal single payer, which same, but we know that he's a horrible liar and a austerity champion. That's been the defining arc of his career. So we really have to pressure him still. Public sector unions have had some pushback, but we have a good labor strategy forming. So if you are a union member, please go to the phone bank at 6 on Thursday and the strategy meeting at 8 on Thursday, because I think it's going to be really, really important to get union members and organized labor to say, we're not going to donate to or commit to politicians who don't support single payer, because this is something that takes, it takes a huge power of the employer away, over our union members, over workers. Hugely important and huge leverage if you do that. So what can you do and what's been going on? There's been regular tabling for the New York Health Act. This is all downstate, like I already referenced, I'm up in Buffalo, but yeah, regular tabling for the New York Health Act, 101 sessions on how to pass New York Health, working with union members and building out that labor strategy, agitating in the rank and file, holding healthcare town halls with the electeds, and engaging in local fights for health justice, like a campaign to stop the closure of Kingsburg Jewish Medical Center, a public hospital down in East Flatbush. And then in Buffalo, we've been, like I said, doing street canvasses and agitating in Sean Ryan in the Senate, Karen McMahon and Bill Conrad's constituencies. We have really, really strong organizers in all of those areas, and they're gonna get hit hard in the next couple of months. So hey, gonna be cool. So we wanna get this done by June. We need a strong base of working class New Yorkers in support. And I think that we're just the people to get that education going. And we need legislators to feel pressured and threatened, like we actually have a real or else, they're not going to support me if I don't support this. My career is in jeopardy, So let's phone bank, let's flood their offices. Let's get out there and table and educate people about this. Let's do door hanging and canvassing and actually be talking to our neighbors. Let's cut turf strategically around where they live and in key high foot traffic neighborhoods. Shouts out to our inside outside strategy by creating pressure and rallies in our movement, as well as actually having our electeds that we can count on. Shouts out to Briar Britsport, who opened up this meeting. So yeah, this week of action, Noah, you wanna talk about this because you're on the OC?
Yeah, I'll talk about this. So this week is our the beginning of our campaign to get this passed by June. We have a week of action going on all week. We're picking up right where TTR is leaving off by trying to build a big statewide campaign to make Albany know that we need this done this year, and we won't wait another year. So it's starting today. It's taking place till next Sunday, April 18th. It's events like this all week, educational events on topics like healthcare and housing, labor organizing for the New York Health Act, like Mo talked about. Health justice is a racial justice issue. So combination education and field events. And we need all hands on deck to get this done. We need field leads. We need help planning political education events, social media, engagement with unions, community organizations, mutual aid groups. So right now we'll post the link in the chat to get involved. There are tons of avenues to get involved, and this won't end after this week. This is going to last till June. Hopefully it'll stop in June once we get it passed. So please, if you feeling as energized as we are and want to get involved, there are tons of ways. Immediately after this, we're having a phone bank. We'll be calling New York City DSA members to let them know about the New York Health Act and the campaign. And we'll also post that link in the chat if anybody wants to come to that event directly after this at 7. The more the merrier. We have tons to call. So please sign up for some of these events. We could use the help. That's all we have. If anybody has any questions about the campaign or the New York Health Act in general, feel free to drop them in the chat, and we'll do our best to answer them. So yeah, so it looks like there are no questions. I'll keep this on for a couple of minutes just to give everybody the chance to capture all the links we just sent. There is the phone bank tonight, a general link to get involved in the week of action. There's tons of events all throughout the week, and also a link if you feel motivated to donate to the campaign to help us get this passed. But otherwise, thanks everyone for coming, and I hope I will see you all at some of these events this week. Oh, Annie, to answer your question, the link the bit.ly that Keith sent is the Facebook group.